something I heard when we were going through our education training that really changed my perspective too. So we always talk about in using a natural method, you're just more open in general. And sometimes that can be even open to changing your intention. It doesn't
Yeah.
mean random things are happening. It means you know on any given day what your fertility is and you can make decisions. And so one thing I talk about with couples as well, especially when working with marriage prep and things like that, is sometimes you may think, well, I don't want to have a baby for X amount of time. And then you find out some things are going on with your fertility, and it may be
Oh,
better,
yeah.
it may be recommended that you actually decide to have children sooner than you anticipated because of these medical things or these things with your fertility going on. So I think that that's a big thing as well.
That's a good point. Actually, as you know, I started charting a good bit before we got married. We moved our wedding up. I mean, obviously, we didn't get pregnant, but we moved our wedding up for that reason, so we could try to get pregnant earlier because of the knowledge that I gained from charting with Creighton.
Wow, I did not do that.
I know. I just realized I've never told you that, but no, it's true. We can make positive changes if we have the information. That's the important part of having that knowledge, which brings us to our next important aspect of fertility awareness, and that is health. Regardless which method you choose, like, it is healthy to know your body and how it works, period. The older you get, the more in-depth the knowledge is required, but it's so good, no matter what method you choose, to understand how your body works. I want to read a quote from Dr. Thomas Hilgers. Our goal in our work, our research, has been to try and find the causes of these problems. Now, like we just explained before, if we're talking about avoiding pregnancy, it comes down to preference, like what method works best for the individual, for the couple, period. Like, you do your research, find what works best for you. If you have a health issue, if you have an infertility problem, then Creighton gives you the most bang for your buck, because the whole goal is to find the underlying cause of that. Not only that, but then to address it with a physician, whether it's just a medical consultant or actual surgeon. Teaching anyone about fertility awareness, we have to help them to understand that this is how far we can go when you're using the Creighton model. Does that make sense?
Yeah, and I just want to add too, in case anyone out there doesn't know, I feel like it's common knowledge to you and I, but Dr. Thomas Hilgers is the developer of the Creighton method and NAPRO technology. And so, I mean, he has fought this battle for years, and he has poured so much research out into that. Like, for me as a nurse, when I hear him, what I hear underneath that is evidence-based practice. And that is what makes it unique. Dr. Hilgers originally took the Billings method, and in any type of medical field or research or anything, something should be able to be researched and its results be redemonstrated. That's how you show it's effective. And so he took Billings, he did all this research, he proved effectiveness. We'll talk about, he standardized it, right? Which is a huge thing in research, standardized so that we can research. And so from that came NAPRO technology and the medical component. And so I think that that's an important thing to talk about, because you and I also talk about physicians who may provide natural intervention, but are not truly providing NAPRO technology, because NAPRO technology has evidence-based protocols, which means the interventions that these physicians are using are based on research. They're not just providing treatment or even diagnostics that they think is important. They are doing things that have been shown to be effective to treat conditions and infertility especially. So go ahead.
I just want to talk about that word standardized you use. Like, that's important, because we got to make sure it's reproducible, but that we're also talking about the same thing. And that's the beauty of when he standardized the mucus observations, because he gave us these definitions that anywhere you are in the United States or internationally, if you're using the Creighton model, it means the same thing. Like, tacky defines an amount of stretch in the mucus that's between 1/2 and 3/4 of an inch. So whenever a woman writes tacky, it's very specific. So when he goes to do the research on the biomarkers or whatever, having the mucus broken down that specifically gives us a lot more information about the quality of the mucus and the mucus cycle and all those other things. How much of the bleeding, what is considered, how many days of bleeding is it considered, has been researched to be considered premenstrual spotting, to where we can see a hormonal abnormality. Those things matter. And it's that kind of detail that we're getting with the Creighton model.
And language is so important, right? So when I say sticky, that means up to 1/4 of an inch. We can't just have women who are using a method making up whatever they think to describe it, because I don't know what that means as a practitioner, and you wouldn't know what that means. And so standardization is key. And I know when people have switched to Creighton from other methods, oftentimes they'll say it is a lot more specific. People who thought they had continuous mucus who actually don't. They're actually having like special category dry. And so it is so specific, and which is why it can be a little overwhelming when you're first learning and we have those frequent follow-ups. But a good quote by Dr. Susan Caldwell, who is a NAPRO medical consultant from New Orleans. This was from her blog that she keeps on her site. So she said, "The Creighton model fertility care system is the most advanced fertility awareness method available at this time. This is a method that not only allows a woman to know her cycle, but also has been extensively studied so as to allow for medical diagnosis and treatment protocols to be implemented using NAPRA technology via a certified medical consultant who is usually a physician, but we know can also be a mid-level provider." And so for me, that quote from Dr. Caldwell says it all. In fact, I think I posted it on my page before. Ever wonder why Creighton? This is it right here. And so I know that was a huge factor when my husband and I were trying to pick a method. With both of us being nurses, we're very scientifically rooted and driven. And it was the extensive research and the medical component that essentially was the hook, line, and sinker for us.
For sure. That's a good point. Just a few more things to close this out. It's important also to note, to understand the quality training you're getting and an instructor. And so any practitioner will tell you that it requires an extensive amount of training. And just to explain a little bit, it's considered an allied health profession. The entire training program lasts 13 months at minimum. And then certification is voluntary after that. Each practitioner is required to complete a 9-day immersion course, followed by a 6-month supervised practicum serving at least 6 clients. Then a 6-day immersion course learning advanced techniques, followed by a 7-month supervised practicum serving at least 12 clients. All of this is overseen by a supervisor. In addition, then we have a 2-day long supervised on-site visit where our supervisor comes in, and our 2 days are devoted to her, basically, where she sits in and watches us do an intro session, watches us conduct a follow-up session to make sure we're doing it right. So
3-hour follow-up session.
Wait, what? A 3-hour? That's true, because it's just they want to make sure they're protecting the value of what they've created, of course. Not to mention multiple assignments. I didn't even mention that. There are a lot of assignments and tests. And then finally, that final exam, which is both oral and written. We're given up to 6 hours long to take it. So you can be confident that if you're getting a Creighton practitioner, that she knows her stuff, or at least she should know her stuff after going through all that. But we just explained that to you so you know what you're getting, basically.
I remember how shocked I was when I learned that.
As a nurse and as a human?
Well, as a human, I think, but I know at first when I was learning the method, my practitioner was a nurse. And so I kind of, I guess, always just thought, well, she's a nurse. She went to nursing school for however long. And then when I considered becoming a practitioner, I was shocked by the extensive work that it was. And I think that really set apart for me that we had chosen the right method, because, we teach our clients, we can't teach you everything in an intro session. It's just impossible. It's too much. And it's the same as practitioners. You cannot learn it in a weekend. You cannot learn it in a week. It really takes that full year long. And I tell my clients, if you're seeing an intern, you have it good, because that means someone with 30 years plus or 20 years experience is also looking at your chart besides me. And so, a total of 18 clients before you can even sit. You cannot sit for your exam without that. Right. And I think another thing is the fact that the program's accredited. I know one thing they talk about is joint commission in hospital. So for hospitals who have a fertility care center associated with them, Joint Commission has been very impressed with the Creighton program, with how the fertility care centers run. We have a standard of ethics that we have to adhere to. We have a governing board, all of those things. So it is extensive.
Interesting.
Yeah, so that you're getting really high quality education and guidance from someone who's been trained really well.
Yeah. So again, the Creighton model is what introduced me to this concept of the whole woman, just from hearing Dr. Thomas Hilgers talk about it on the radio. I talked about that on our first video, and just this kind of brings it home, and it kind of opens up the doorways, the pathways of the other aspects of the whole woman, because Creighton kind of helps us, at least, and when we refer our patients to physicians, they're kind of looking at the woman as a whole person, not just a body part that can be turned on and off. We're talking about other systems and how that all plays together in the same picture. And so with some more videos, we're going to go into also how we talk also with Creighton about emotionally, with relationships and all that. It all applies. And that's what we deserve as women. And that's what we want you to know, that you can expect this from your healthcare providers, because it is available and you are worth it. So.
And we will be going into more details about a lot of things. Like, we really skimmed through NAPRO today. So you'll be hearing us talk a lot about the medical component as well, and identifying root causes, treating root causes, all of those things. Like Mary said, I think the longer that we've practiced as Creighton practitioners, the more that we've seen that fertility is affected by so many things. We talk about, physical, mental, emotional, all of those things. And so we'll be building into addressing the whole woman. We want to see the whole woman. We want to see a physician who sees the whole woman. And so that is our mission.
For sure. Well, very well said. Yeah. And you can tell a difference when the woman feels like you care about her and who she is as a person. You see the reflection in her demeanor. And sometimes even in the chart, if the stress, sometimes they have to stop charting altogether. But if they can just feel heard, it gives them the courage and the motivation to keep on going. It's so, anyway, that's what we mean by the whole woman. We thank you so much for sticking around with us and coming on this journey to serve the whole woman. And we look forward to seeing you next time about a different topic. Remember, if you're a practitioner or a client or a non-client, you can message Lisa or I. Find us on Facebook and Instagram. I'm at Taking Back the Terms. Lisa?
I am at CRMS of Acadiana.
Yeah, so just find us. You can send us a direct message if you have a question or something that you want us to talk about on one of these videos. Y'all take care. We'll see you next time.